to BT Vancouver on this Friday morning. As we've been telling you, the province has recorded 170 illicit drug overdose deaths, and that is a new number when it comes to a record. Unfortunately, that's the most illicit drug overdose deaths in the province for 1 month ever. And we're going to bring in someone who's an expert on this right now, Travis Lupick. You are an author, a journalist, and you've covered this issue extensively. Welcome to the show.
Thank you for having me. First
of all, what goes through your mind when you see that number?
I felt sick when I read this number yesterday. You know, someone on social media once said, "Oh, this is great for journalists when the deaths jump like this." I've had enough of this story. I don't want to be covering it. And when the numbers came out yesterday, I felt physically ill.
Did you feel surprised at all when you saw that number?
No. 3 or 4 months ago, we predicted that our overdose deaths were going to skyrocket under COVID and the coronavirus response measures. We saw this coming. Health officials saw this coming. To their credit, they did take some measures trying to prevent it, but obviously we're not entirely successful.
And these are mainly deaths happening people that are alone, right? These are not safe injection site deaths or people that are supervised because of the isolation these days with the pandemic and everyone being encouraged to be alone in those early days. Was that a result as well, that it's sort of encouraging people and they're more prone to those situations where they will be using alone?
That's exactly right. Nobody in Canada has ever died at a supervised injection facility, anywhere in Canada, anywhere in the world, actually. I've checked the statistics on this. Largely why these overdose numbers have spiked is because our response to COVID is directly in opposition to our response to the overdose crisis. For 4 years, since a public health emergency was declared in 2016, we've been telling people who use drugs in the presence of a friend, use drugs in groups, use an injection site, do not use alone. And now, under COVID response measures, we're telling people social isolate, remain alone. We're shutting down supervised injection facilities or limiting their capacity. The response to the coronavirus is in direct opposition to the response to the overdose crisis, and that's killing a lot of people in BC.
Are we seeing the illicit drugs more toxic since the borders have been closed?
That's the second piece of this. Borders have been closed, which has interrupted illegal drug supplies. And so to compensate, dealers are cutting their products with an increasing variety of substances, and especially with fentanyl and carfentanil, these incredibly potent synthetic opiates that act similar to heroin. You know, that they'll fend off withdrawal. The high is sort of similar, but they're much more deadly. So, you know, it's sort of like when a recipe is missing an ingredient. You know, you use another ingredient to try and sort of spread things out and make the recipe work. Yeah, that's what's happening. But the ingredient that they're supplementing with is deadly.
You've been pushing for years, obviously, for decriminalization when it comes to illicit drugs, but that's not enough, right?
I have been pushing for decriminalization, removing criminal penalties for personal possession. I'll also note Dr. Bonnie Henry, something of a hero in BC and across Canada right now, is similarly pushing for decriminalization. If we're going to listen to her on coronavirus, I think we should listen to her on overdose deaths. But that's correct. Decriminalization would not by itself solve the overdose crisis. I think it would help. I think it would minimize the number of deaths we're seeing. It would bring people out of the shadows. It would encourage society at large to treat addiction as a health issue as opposed to a criminal issue. But it would not solve by itself the fentanyl crisis. For that, we need full legalization and regulation. You know, it feels like a no-brainer to me at this point. If these drugs are going to be out there, why not get the government involved and regulate them?
All right, Travis, we really appreciate your time. We have to leave it there, and we'll put this online so we can spread the message to all of our viewers. Thank you so much.
Thanks so much for having me on.
All right, you take care. That's Travis Lupick, journalist and author who's covered the downtown east side and the opioid crisis extensively. We'll be back with more BT after this.